Hello, it's been a while since I've made a video. I've been really busy, but less busy now because I now just have one job. I was previously working part-time in ICU and full-time in clinical professional development. And I finally decided to quit my bedside job in ICU and just focus on clinical professional development. So here I am. I want to make this video for newly qualified nurses or soon to qualify nurses because what I've noticed is some nurses are not aware of the fact that you don't wait until you've graduated to apply for a job. Now, like I said, I work in clinical professional development. So part of my role is to teach residency and fellowship classes to critical care nurses, new to critical care nurses. So these are nurses who are newly qualified and lucky enough to get a job in an ICU or an area considered critical care, such as progressive care or IMC. And also nurses who have experience but not in critical care and are new to critical care. So when it comes to recruitment, how it works is that hospitals have cohorts. So for example, the hospital group that I work for here in Texas has 6 cohorts per year. So that's February, March, June, July, September, and October. And obviously, if you're starting your job in February, it means that you would have had to apply for that job several months previously. So if you're a nursing student and you want to start your job in February as a resident in critical care or whatever specialty you choose, even med-surg, all specialties start at the same time, because that is the way that it is organized in order for everything to flow from the HR perspective, funding, the money that's made available to recruit you, to the specialists that have to teach you about that specialty, as well as having adequate preceptors available to precept you when you start. So you have to apply for this post several months in advance. And these posts are opened up, I'd say, if I can think of someone I know who I was working with in an ICU, who then decided to switch from ICU to neonatal ICU. So that meant she was going to be a fellow in NICU from being an ICU nurse in an adult ICU. She is starting in July, but she actually started applying for this post in January. And she wanted to start with the June cohort, but the June cohort was full. So they interviewed her, even though they were full, and then they said to her, if you're genuinely interested, you'll wait for the July cohort. And because she was genuinely interested, because the hospital she was applying to is one of our more prestigious hospitals, Dell Children's. So she waited from all that time, around January time, when she was given the job offer to start in July. So this gives you an indicator of when you need to start applying for a job. So what I'm saying is, if you're finishing your nursing degree in September, you probably should have started applying already for jobs, because you're going to need, or you're going to want to be in a residency, in a nurse residency, because that's where you're going to get the support that you need as you start your career as a nurse. If you're in a residency, it's a structured program, and many of these programs are accredited by various accrediting bodies. So what that means is there's guidance in terms of the kind of preceptorship that you receive as a nurse resident. So if you're going to be a critical care nurse, for example, and you're a newly qualified nurse, in our organization, you're going to get critical care classes, which is a didactic classes where you're learning initially the basics of critical care, and then what you learn then advances to more advanced stuff, advanced hemodynamics and things like that. And then you also get skills labs, where you get to practice critical care skills in a lab situation away from the bedside, because that's what evidence says, that if you're learning away from the bedside without the pressure of the patient present or your preceptor or whatever it is, you're more likely to learn because you don't have that pressure. You're just focused on learning and you're not focused on, am I going to harm this patient? And so you get the didactic, and then you also get the skills lab. In addition to that, you get seminars, and the seminars are for your professional skills. So this is where you get to meet with other residents from different specialties, and you have seminars where you're discussing the professional aspects of nursing, like dealing with conflict in the workplace or dealing with stress in the workplace, that sort of thing. And it's also a good place for you to reflect on your practice and think about next steps, like, okay, once I finish my residency, what kind of skills do I want to have? What do I want to work on next once I'm confident in my skills in this specialty? What is it that I want to do next? You know, you get that sort of guidance and support in those seminars. And so usually the residency will last a year, as well as a fellowship. It will last a year. And at the end of that year, you've had the opportunity to learn the skills that are specific to your specialty. You've had preceptorship. And the preceptorship, even though they might give you a guideline and say, as a resident, you're going to get 18 weeks of preceptorship, which is 18 weeks of working beside another experienced nurse who is your preceptor. And then you begin to practice independently after 18 weeks. That is not set in stone. If you're feeling at 18 weeks that actually I don't feel ready, I need 2 more weeks or whatever it is, you can say that. You can speak up and say, I feel like I need 2 more weeks because, and then give a good reason for that. And then you know, it might be that you are feeling anxious, but when your preceptor and other people are looking at you and how you practice and how you look after patients and the things you're doing, they might feel that, yeah, actually you're doing a lot better than you think, and you're expecting yourself to be doing better than you should be at that stage, because really the expectation is just for you to be an advanced beginner, not an expert at the end of your preceptorship. Much of what you will actually learn will happen when you're on your own, when there's no one looking over your shoulder and you're making mistakes, hopefully not fatal ones, but on your own, you're going to be able to really reflect and think, oh, I did it like this time. Maybe next time I'll do it like that. So that's something to be aware of. Applying in good time and choosing a residency so that you have the adequate support, you have the support that you need. When it comes to your resume needs to include your clinical experience. So talk about the various clinicals that you had, where you went and what skills you practiced, because that's the experience they're looking for. They're not looking for you to have the same experience as a qualified nurse. They're looking for you to talk about your clinicals and what you learned on your clinicals. If you've been working in healthcare before, maybe you were a PCT, maybe you were an LVN, obviously that's wonderful experience to include in your resume, because it shows that you're probably a few steps ahead of newly qualified nurses, because you already have an idea of how things work in a hospital or whatever setting it is that you're working, and you already have an idea about how to interact with the patients and some of the challenges that you would face. And that also then leads me to talk about pay. Right now, we're in June 2026. So right now, when I was looking at the local salaries for newly qualified nurses, they were ranging anywhere from $36 to about $42 an hour for a starting salary for a nurse resident. And the variances in pay were dependent on the unit. So some people think critical care areas are going to pay way more than med-surg areas. That's not true. Actually, when I was looking at the list of salaries that various people got as newly qualified nurses, some of the people who had the higher paying starting salaries were not in critical care. They were actually in med-surg. So I think sometimes the pay scales vary slightly based on the department you're going to and what they're willing to pay in order to attract staff. I think that can be a factor that affects how much you're going to start earning. But from your own perspective, you have to ask yourself, do I want to go for the job with the most pay, or do I want to go to the job that's going to fulfill my dreams as a nurse? What is it that I thought I would be doing as a nurse? And would I get that in the department I'm going to? Because if you go for the pay and not really think about what's it going to be like working there, you might find yourself really disappointed and frustrated. Critical care is not for everyone, and med-surg is not for everyone. So you have to get to know yourself, figure out what's my personality type and what kind of work would I enjoy doing, and then decide where you're going to work. So I hope that helps for people who are going to be graduating from nursing school. Start applying early. Nobody will be, when we look at your applications, when the recruiters look at your applications, they're not looking for you to already have your nursing license if you're applying for a residency post. We actually have people that start their job without a nursing license, and then they're given a 3-month period. I think it's 90 days to pass the NCLEX. If at that point you don't pass the NCLEX, then options will be discussed as to, do they terminate your post at that point, or do you then become a PCT or in that department? But you do get a chance, even if you haven't passed the NCLEX. When you are offered the job and your start date that you agreed to has come, you can start, and at that point you're not called a nurse resident, you're called a graduate nurse. So you're a graduate nurse, but you're not yet a registered nurse, because you've graduated, you've got the degree. What you don't have is the nursing license. So when you are working as a graduate nurse, you've got 90 days in which you can go past your NCLEX. So don't hesitate to apply because you're thinking, oh, I haven't passed the NCLEX yet, or I'm not sure if I'll pass. Give yourself a chance. You just never know. I've worked with people who hadn't. One girl I worked with, I think she passed her NCLEX the 3rd time. And she passed that 3rd time when she was already working with us. Many people didn't even know about it. Many people didn't know that she hadn't passed her NCLEX because people generally don't ask questions about that. Maybe her preceptor knew, the manager knew, and maybe a few people that she had shared it with, but other people didn't know. Obviously, it's safer for everyone on the unit to know so that they delegate work to you appropriately. They're not delegating work to you that you're not allowed to do if you don't have a nursing license. So those are just things to be aware of. So make sure you're applying for those posts in good time. If you're not sure when the various hospitals recruit and when their cohorts are, you can reach out to them and say, hey, I'm interested in your residency program, nursing residency program. When can I start applying? And they might even say, okay, when they'll tell you the dates when they open up the posts and say, these posts will open up in this month and that month and that month. So, if it's January, the posts would have been opened up maybe the previous November or even before that, and so on and so on. So what you need to do, if I was you, is to go online and create an account with the various hospital groups that you are interested in applying to, so that you can get alerts when posts open up. So you can set up alerts to say, I want to be alerted when these types of jobs are posted. And then as soon as the posts open up, you apply. They're very competitive. There's so many newly qualified nurses who are wanting to get residency posts, because that's the best way to start your nursing career, with preceptorship, with good support. What you learn in nursing school is what you learn in nursing school, and nursing schools are not created equally. Some nursing schools focus on preparing you to pass the NCLEX without really preparing you to become a registered nurse, and that's why it's advisable to go and do a residency, a nursing residency, so that you start your career on a good footing. I hope that helps. I don't know if I can say much more about it, but if you have questions relating to this topic, drop a comment below. And of course, if this was useful or helpful, like, share, and subscribe so that other people might be helped by it. Bye.